The reoviruses are an interesting group of viruses. Reo is actually an acronym: respiratory, enteric, and orphan viruses. They're viruses that just don't really have any other classification except for they all have the same morphology and the same genetic content. So these are our first viruses that have a double-stranded RNA genome, and it is segmented. One of the other unique features is they have a double capsid. So it's really important for you to think about what benefits that would have for the virus and how that would make it more difficult for disinfection and removing these viral particles. In terms of their replication, it's really quite interesting. They actually will keep their double-stranded RNA within the core at all times. And part of that is because one trigger of our immune system is that our immune system has toll-like receptors inside of the cells that recognize double-stranded RNA as foreign. Because in our bodies, we don't make double-stranded RNA. The only time there's double-stranded RNA is when we have a viral infection. So these reoviruses do the best they can to hide that double-stranded RNA from the toll-like receptors in the internal environment of the cell. We are going to talk about one particular reovirus, which are rotaviruses. So rotaviruses, it's a family or group of viruses that are a really common cause of infant diarrhea. And one of the things that is important to think about is that in other countries, not the US, but countries especially that don't have the best water sanitation, the leading cause of death in children under the age of 5 is diarrhea. So the fact that this is one of the leading causes of diarrhea is very important. Because it has that double capsid, it is very, very stable to all sorts of environmental insults, including detergents, low pH, freeze-thaw cycles. And in fact, the proteolytic enzymes in the GI tract actually help enhance its infectivity. Human disease is caused by groups A through C of the rotaviruses. So as I mentioned, they are really great at surviving in the stomach, especially after a meal. Remember, when you eat, it temporarily raises the pH of your stomach because some of the things you've consumed can help neutralize the stomach acid. So you can have that, not only the double capsid providing stability in the face of acid, but you also have a slightly increased pH, which is less stressful. Within 8 hours of infection, there are detectable viral protein and RNA in cytoplasmic inclusions, so in some of the cells of the GI tract. During an active infection, a patient could be shedding about 10 billion virions per gram of stool, a lot like the noroviruses where there's just shedding of tons and tons of virus. What we see in infected cells is a shortening of the microvilli. Remember, those microvilli are really, really important for fluid absorption. So because they are being shortened, because you're losing surface area in the GI tract, you're losing the ability to absorb water, and that water has to go somewhere. You're also getting infiltration of immune cells. So like I mentioned, the rotaviruses do prevent water absorption. They also have a protein that's called NSP4 protein. It acts like a toxin, but it's not actually a toxin. It's not secreted, it's not released. It is just part of the viral particle, the virion. And that leads to the influx of calcium. And when you change the ion imbalance, that's when you change fluid balance and a disruption of the tight junctions. As you might imagine, antibody with an encapsulated virus, antibody is really important for immunity and for clearance, especially our secretory IgA, because our secretory IgA is what will protect the GI tract. It is estimated that 95% of children worldwide will be infected by the age of 5. Of course, those numbers in the US are going to be a lot lower. Before the introduction of the rotavirus vaccine, it was estimated that 80% of children in the US would develop a rotavirus infection before the age of 5. And every year there would be 20 to 50 deaths because of rotavirus. As you might expect, this is a fecal oral virus. Max shedding, that 10 to the 10th virions per gram of feces, is between 2 and 5 days after the symptoms begin, and it can be transmitted through contaminated fomites or hands. And remember, it's double encapsulated. It has 2 capsids. So that's really going to make it difficult to clean, the restroom if somebody's got rotavirus. And when we're talking about the age of most rotavirus patients, many of those children might still be in diapers or learning to be potty trained or not able to control accidents. So it gets messy, we'll say. Symptoms would include vomiting, diarrhea, fever, and of course dehydration. And that's the major issue. We worry about dehydration in our pediatric patients. We're not really going to see any blood or white blood cells in the stool. We're not talking about real destruction of the GI tract. We're talking about just the inability to absorb water properly. For most patients, including pediatric patients, this will be self-limiting, especially if there are no pre-existing conditions. But in patients who have pre-existing conditions, that can be a little bit more challenging. The infection can be diagnosed by the presence of viral antigen in the stool. This is also one of those where you could theoretically do electron microscopy of the stool and see that really high concentration of virus, or through reverse transcription PCR to look for the viral genetic material. There are no antiviral therapies, but there are vaccines available. So there are 2 vaccines available. One is available for 5 of the strains, one is available for 1 strain. These vaccines are typically given orally. So if you have children or if you have pediatric patients, this is one that you'll give by mouth. That is always a benefit if you can give the vaccine in a similar way to the way that the infection is acquired, because you'll get the most robust immune response in the appropriate target tissues. And so this helps to give a really nice secretory IgA immune response in the gut. And vaccination begins very young. It's one of the first vaccines that children get at the age of 2 months.